Welcome back, viewers. Today, we are going to learn an essential skill that can make a big difference in someone's life. Before we start, remember that collecting a blood sample should only be done by trained professionals or under their guidance. This video is for educational purpose only. Always prioritize safety and follow proper medical protocols. How to collect a blood sample. Whether you are a healthcare professional or just want to be prepared in case of an emergency, this knowledge is invaluable. So let's dive right in. To begin, let's gather the necessary equipments. One is a sterile glove, alcohol swab, cotton balls, adhesive bandages, blood collection tubes, syringes with needles, biohazard container for safe disposal. Once we collect all these materials, now let's ask the patient to sit comfortably or lie down so that he is comfortable for the procedure. Addressing any concerns they might have, confirm their identity and check for any allergies or conditions that may affect the process. Before touching anything, remember to perform proper hand hygiene. Wash your hands thoroughly with soap and water or use hand sanitizer. Next, we need to find a suitable vein for blood collection. Typically, the antecubital vein in the inner elbow area is used. Feel for the vein and examine its prominence. Clean the selected area with alcohol swab. Start from the center and move outwards in a circular motion. Allow it to dry completely to avoid contamination. Now, put on sterile gloves. This step is crucial to prevent the infection. If using a needle and syringe, hold the patient's arm with gentle pressure. Insert the needle into the vein at a slight angle. Once you see blood flowing into the syringe, adjust the angle slightly to ensure proper blood flow. For blood collection tubes, ensure they are appropriately labeled with patient's details. Attach the tubes to the needle or syringe and collect the required amount of blood for each test. Once you have collected enough blood, withdraw the needle gently but swiftly. Apply light pressure with a cotton ball on the puncture site to prevent bleeding. Dispose the used needle and other contaminated items in a biohazard container to ensure safe disposal. Now apply an adhesive bandage to the puncture site. Make sure the patient feels comfortable and secure. Finally, thank the patient for their cooperation. Discard your gloves properly and perform hand hygiene once again. Congratulations! You have learned how to collect a blood sample properly. Remember, this is a skill that requires practice and supervision. If you are not a healthcare professional, please leave this task to the experts. Thanks for watching and stay tuned for more valuable tutorials. Stay safe and take care. Subscribe for more health and medical tips. Remember to consult a healthcare professional for medical advice. Stay informed, stay healthy. Bye bye. Thank you.